Welcome to Watch Your Mouth, the podcast of the Ministry of Health and Wellness Oral Health Unit. I'm your host, Dr. Chanel Dempster-Peart, and today we're diving deeper into the world of oral health with none other than Jamaica's chief smile builder, Dr. Irving Mckenzie. For many years, Dr. Mckenzie has been tirelessly leading the charge for better oral health in Jamaica. As Chief Dental Officer in the Ministry of Health and Wellness, he has influenced national policies. He has contributed to academic excellence as the founding Dean of the College of Oral Health Sciences at UTech and shaped future generations of dental surgeons. He's also a respected fellow in the prestigious dental organizations worldwide, a diplomat of the International Congress of Oral Implantologists, and a master in the American Academy of Implant Prosthodontics, just to name a few of his incredible achievements. Dr. Mckenzie's dedication has earned him numerous accolades, including the Badge of Honor for Meritorious Service in the fields of health as well as education. And as much as he's losing sleep over improving our oral health system, we're confident he's not losing any teeth. Today, we'll discuss the state of oral health in Jamaica, the importance of dental care, and how we can all play a part in protecting those pearly whites. So sit back, relax, and get ready to learn from one of the best in the field. We're going to cover as much as we can: dentistry as a career, oral health policy, and whatever else we can get to. Let's get started. Dr. Mckenzie, so good to have you here. Thank you for being with us.
You're welcome.
When you started in dentistry in Jamaica, what was it like?
Interesting. I remember coming to Jamaica with one main interest, particularly just to see how I could make a good name for myself and a great impact as a very good dental surgeon. However, being bonded to the government of Jamaica and starting to work in the area of public health, I became increasingly aware of the great need for oral health care for the masses on a whole. We had just about one dentist in 17,000 of the population. From a public health perspective, most of Jamaica was designated or is designated a dental professional shortage area. So not having the adequate numbers of dentists created a great disparity in terms of access to care, especially to those who need care the most.
Wow, so what is it like now?
Well, Jamaica has made tremendous leap in the field of public health and in particular dental public health. First, we introduced salt fluoridation back in the 1980s that actually helped us to reduce the level of decay, missing and fill teeth, where we had a reduction from 6.7 to 1.08. Our dental cadre was very, very low in terms of dentists. Currently, we have about 450 dental surgeons right now that are actively practicing in Jamaica, and another 50 to 60 dentists that are registered elsewhere and visit the country from time to time. So where are we right now? The ratio of dentists to the population has increased tremendously. And in particular, in the government, we have moved from 30-something dentists to over 100 dentists in the public sector. So we are making tremendous effort and stride in terms of addressing the dental workforce and our impact on the oral health landscape.
It sounds to me then that for the public, it will be easier to locate a dentist now that there are more dental surgeons available here in Jamaica? Is that correct?
100%. Before, with the very low ratios of dentists that I spoke about, most of our dentists were concentrated in the metropolitan area. So Kingston and St. Andrew, Montego Bay, let's say Spanish Town and Mandeville may have some amount of dentists, but in between, it was like a dental wilderness or desert. But currently, our 80 or so health facility in government now see dental surgeons going to those facilities. So those who are unable to afford care can now access care more easily.
All right. So, is there still room for persons who may be considering a career in dentistry? And if so, what advice would you give them?
Okay, when you look from a public health perspective, you ask yourself the question, just how many dentists are enough? Just exactly what our oral health needs are. First and foremost, we just like to explain to the public and to everyone that dentistry is not just about a smile, it's not just pretty teeth and a beautiful posture. Dentistry is about health. And by speaking about health, I'm talking about quality of life. I'm talking about one's ability to speak, eat, breathe, and even what we say socialize without pain, discomfort, and many of the what we call psychosocial component of dental of poor oral health that people associate dentistry to addressing. So oral health is about health. And your mouth, as I'm sure most of us will know, is connected in many ways that we say to all your vital organs. So one's oral health can affect not just your mental health, can affect your cardiovascular health and many aspects of your health. So dentistry is about health. And we like the public to know that deferring oral health care can be a costly matter, both in terms of life and in terms of good health care.
So, it's how has the field of dentistry evolved over the years? Because is it that we've always had this mindset when it came to oral health being connected to our general health?
Okay, our mindset, I would say, and is anecdotal, is that dentistry is a thing about hygiene.
Mm.
So people normally think about it's about brushing your teeth. And that's a good thing because at least your mouth is an accessible cavity and you can do preventive work. And it is important for us to know that having an accessible cavity and the fact that our mouth, our teeth, and the health of our oral tissues tend to act as what we call a sentinel for what your future health will be like. For example, if one should consume a diet rich in added sugar, per se, if one should um, practice certain things that we call non-nutritive types of behavior, like consuming a lot of alcohol or smoking and so on, then very, very early, unlike the rest of your body, we begin to see signs of poor oral health. In the case of your teeth, where our teeth reparative ability, our ability to heal itself, is very poor, we can see signs of dental caries and so on. Whereas for the rest of the organs, our organs like our kidneys, our livers, our lungs, where our cells are keep repairing itself, it takes a longer time to see the ravages of poor dietary attitude, poor health in general. And that's why we speak about issues of chronic non-communicable diseases like your diabetes, your cardiovascular disease, etc. that comes later in life.
Mm-hmm.
But oral diseases appear much earlier and therefore becomes an indicator and sentinel of what is going to happen to you later on. So, from your first question about is there space or is there scope for dentistry? Yes. And for anyone who's interested in dentistry, just think about it. We all need our 32. We all need our pearly whites. And our teeth are for life. And we have 3 million Jamaicans. Just think about it. 450 dentists. There's a lot more room for dentists on this island.
What skills do you think someone considering dentistry would need?
Skills. Interesting. Today, I have a bias of public health where I'm thinking that I like most of my dentists to be public health minded because we're not just seeing the individual patient, but we're seeing the bigger picture. We're seeing Jamaica. And under Vision 2030, we want Jamaica to be the country that we live, we want to live, we want to do business, and we want to have our families, right? And dentistry has a major role to play in terms of that goal from a sustainability perspective and from the perspective of we living longer. I like to explain to individuals that if you are not true to your mouth and your teeth, they be false to you. And not only will they be false to you, but you'll be losing not just you'll be losing days. So if you look at life in terms of God has given us 70 years,
Mm-hmm.
having poor oral health will shorten that. So we're thinking of people making a strong effort to having and thinking and actually practicing good oral health. So public health is important. Prevention is another major issue
Mm-hmm.
where I believe like we're big on prevention because we think our main goal here is to promote, restore, and maintain good health. So having good skills like, a dentist is exceptionally, dentists are very good with their hands.
Mm-hmm.
Dentists are like artists. We can help to restore that smile to world class level. I heard one dentist talk about orthodontics.
Mm-hmm.
Make sure your teeth are aligned and it improve your self-confidence, etc. Another skill that dentists have is the whole aspect of the communicative skills, apart from the technical skill of filling, cleaning, doing extractions, doing root canal, and you name the works. But communication, dentists are great communicators because we use our communicative competencies to promote health. We use our communicative competencies to teach one how to appreciate the virtues of life. And that oral health blends just nicely with that because you will not be healthy without good oral health.
That's quite a bit that's required of dentists. It sounds like with this very important job, there comes a lot of responsibility. But tell me, what would you say is the most rewarding part about being a dental surgeon or being in the field of dentistry?
At one time in my life, I considered doing cardiovascular surgery.
Interesting.
Yeah, I think of even doing ENT surgery.
Mm-hmm.
And I had an experience where it actually, we Jamaicans like oxtail. And I broke one of my tooth, my wisdom tooth.
Wow.
And I was in so much pain. And I had to go to the dentist for an emergency.
Mm-hmm.
And I had no idea that after going to the dentist and the dentist seeing me and addressing my need, that my problems would have been solved within a couple minutes. There's a thing about being a dentist in that when you see a child, an adult, an elderly person come to you and they're in pain, and pain is one of the major issues that drives people to the dentist. And you can solve that pain or you can solve that low self-esteem issue, or you can solve that major health issue, it is so rewarding that you have made a tremendous impact in the life of a person. And what you say is rewarding to me. When I look right now within the public sector and I see people can access not just extraction, because that was a thing that when you come to public sector dentistry, people came for extractions. Now people can come and have all the levels of preventative work being done. I see persons from the womb to the tomb accessing fillings. They're accessing dentures. So we have a program called Second Chance Smiles. And that has tremendously changed the lives of many persons because it has improved their quality of life. Because when you don't have teeth and you live in some places in Jamaica, it actually reduces your employability levels because your self-esteem is low. And if you think you like the job in tourism, let's think about smiling without your teeth. So we have made a tremendous impact on the Jamaican landscape, but much is yet to be done because we have to overcome the barriers of low literacy in oral health because people still think that oral health is just about hygiene, it's not about general health and well-being. So when they have oral health issues, especially our men who tend to delay going to the dentist, who tend to delay having their teeth, a checkup on their teeth, because let's face it, you can't see the back of your mouth.
Yes.
You may look in the mirror and you say, oh, up front is all right. But you don't know what else is going on in your mouth. So you need to have the expert eyes of a dentist to see just exactly what is happening. And we have the competencies to look at what is there,
And assess.
not only assess, but we can form the necessary linkages. We can establish the necessary linkages between those oral health conditions and other systemic health conditions. So the dentist is very important, not only for oral health, but also to improving one's general health and well-being.
You mentioned hygiene again. There is a category of workers called the dental hygienists. And then you're mentioning your dentist. I know there are other team members, assistants, therapists, nurses, technicians. Let's talk about the dental hygienists and how, since dentistry is not just about hygiene, what's their role and how is it different from being a dental surgeon or a dentist?
Okay, to speak about, you're actually letting me talk about the dental workforce because dentistry is usually practiced in a team approach. The dental surgeon, the clinical expert in dentistry, is a team leader. And the dentist is accompanied by, if you're in the public sector, you may have a dental nurse. And these are dental auxiliaries that assist the dentist in the management of children. The dental hygienists, I call them my go-to persons in terms of prevention because they will tell you hygienists have a passion for prevention. And you have your dental technicians that are very good at creating, I call it creating smiles, creating wonders in the mouth because they make dentures and various prostheses for the dentist who actually examine the patient, instruct the technician on what to be done. The technician will make the prosthesis and the dentist will do his work. But the hygienists are amazing persons because as an adjunct to what dentists do, they help to keep you smiling. The dental hygienist would ensure that we keep our appointments for prevention and ensure you get all of your checkups, ensure that your periodontal health is intact, and of course, by working alongside the expert diagnostician in oral health, it becomes a wonderful approach in terms of not just workforce distribution, but hence the dentist can see more patients. And we have a person here who's dedicated to prevention, and the dentist can focus on a lot more complex issues in terms of oral health.
So the hygienist works with the dental surgeon.
Right?
They are supervised by the dental surgeon,
That's
but
correct.
part of the team. Do they collaborate a lot in our public health sector?
100%. Well, in the public health sector, we are currently working on getting hygienists in the public health sector. The Southern Regional Health Authority is one of the first region that has gone out there. They have pioneered the path in terms of using dental hygienists. And these levels of professionals are making a tremendous impact in terms of our preventative programs. From the perspective of Jamaica, the University of Technology and the Northern Caribbean University have been training dental hygienists. So I'm thinking now that we're having more and more of these professionals who are making a significant contribution to ensuring that Jamaica keeps smiling.
Dr. Mckenzie, you're such a wealth of knowledge. We have to make this a two-part episode.
Most definitely.
Great. Join us next time as we continue this conversation with our Chief Dental Officer. Watch your mouth.